Hi everyone, my name is BrunoRobalo and I'm going to present you the results of my poster, which is poster number 1285. So of course you can, if you want to know more, you can ask me during the conference or of course you can send me emails. So basically, as you know, brain networks reconstructed from diffusion MRI suffer from a lack of reproducibility between scan and rescan. And one of the most straightforward ways that we can try to improve this reproducibility is to remove potential false positive connections from the network, and this is done by thresholding. And in fact, some studies already suggest that thresholding can improve the scan-rescan reproducibility. But these studies have been done mostly using data sets of healthy controls, high-quality data sets. So when we're talking about longitudinal studies with patients included, it is still not clear whether thresholding improves the reproducibility without removing effects of interest. So in this study, we asked two questions. We ask whether thresholding also improves the reproducibility in patient data sets, but at the same time, if it preserves the effects of interest, if it does not damage the inter-individual variation of certain metrics and the sensitivity to longitudinal change. So I'm going to quickly here move to the results. So to reply to the first question, what we are seeing here in this plot is our similarity metrics between baseline and follow-up. So how similar are the two networks that we find between at scan and at rescan. So here all the way to the right is the unthresholded network, and all the way to the left is when we apply the most severe thresholds, and of course in between we have other threshold levels. And as you can see, there is here a range of thresholds where the scan-rescan reproducibility is improved compared to when we apply no thresholding. So it seems that in patient data sets, thresholding also improves the similarity between scans. But now if we move to the second part where we try to understand whether thresholding damages or alters the inter-individual variation in outcome metrics, and one of the most used outcome metrics to assess disease effects is global efficiency. So here we're looking at the spaghetti plots here, we are looking at change in global efficiency between baseline and follow-up. And as you can see, there seems to be a decline and of course some variation in the data because different subjects have different values. And we want to understand whether thresholding alters the inter-individual variation here of these positions in the plot and also the slope of the plot. And this is what these correlation matrices are telling you. So here on the left, we're looking at whether the positions in the plot change. So when the correlation is 1, it's because it did not change, and when it's very low, it's because it changed. So here, for most of the threshold levels, the inter-individual variation is maintained, and the same thing for the slope of the decline. So here, it does not change until we apply very severe thresholds. And now to be even more specific, we looked if the change between baseline and follow-up was significant, and if it was significant, what was the effect size, and if this effect size was preserved when we thresholded. So as you can see here, before applying any threshold, so here all the way to the right, the change was significant. So here the t-value was 3.7, so the critical t-value was 1.99. And as we apply thresholds, the change remains significant, and the effect size actually varies between, let's say, 0.27 and 0.49. But actually, the largest effect sizes are even observed for certain threshold levels, so between 0.05 and 0.01. And this is actually the threshold levels where we had the highest reproducibility. So the conclusion is that indeed, thresholding can improve the robustness and reliability of scans of brain networks in repeated scans. But at the same time, the effect sizes that we observe before thresholding are not eliminated. So that was it. Thank you, and if you have any questions, of course, you can ask.